Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is attachment of clavicle. In the previous video, we have already discussed about the morphology of the clavicle, and now we will try to discuss about the attachment of clavicle. First, from the lateral end, we will start. In case of lateral end, here the attachment, here it is attached with the acromion process of scapula and forming acromioclavicular joint and here is the attachment of acromioclavicular ligament. So in case of lateral end, here it is attached with the acromion process of the scapula and forming the acromioclavicular joint, and here is the attachment of acromioclavicular ligament. So it is the attachment of lateral end. Now we'll come to the medial end. In case of medial end, here it is attached with the sternum, especially the manubrium part, and forming sternoclavicular joint and here is the attachment of capsular ligament. So we have completed the lateral end and the medial end. Now we will come to the body or shaft. Now in case of body, here we know that body has two parts. One is attachment, one is medial 2/3 and one is lateral 1/3. So let us start with the medial 2/3. Attachment to medial 2/3. Now first, it has four surfaces. We all know that. First, the superior surface. In the superior surface, there the attachment of clavicular head of sternocleidomastoid muscle, and this sternocleidomastoid muscle is also known as Pandora box. Now in the second part, that is the inferior surface, has the attachment of sternohyoid muscle. Number 3, that is the anterior surface in case of anterior surface, here is the attachment of pectoralis major muscle. Number 4, that is the posterior surface. As in this surface, or at this surface, there is a groove called subclavian groove for the attachment of subclavius muscle. So these are the attachment of the medial two-third. Now we'll come to know the attachment of lateral one-third. Now we all know that the lateral one-third has two border and two surfaces. Number 1, anterior border. In this surface we have deltoid tubercle for the attachment of deltoid muscle. Number 2, that is the posterior border. Posterior border has conoid tubercle for the attachment of conoid part of coracoclavicular ligament. So what are the attachments? In case of attachment of lateral one-third, here is the anterior border. So here is the attachment. Here we have deltoid tubercle for the attachment of deltoid muscle. Then posterior border. Here we have the conoid tubercle for the attachment of the conoid part of the coracoclavicular ligament. And we also have the attachment of trapezius muscle. And number 3, that is the superior surface. Superior surface has no such importance. Number 4, that is the inferior surface. Here we have trapezoid ridge. Now what is ridge? Ridge is a sharp line or crest. And here we have the attachment of conoid part of the trapezius muscle. Now we have a question in our mind, that is why clavicle is known as beauty bone. So the answer will be, as this bone is situated upper part of the thorax and due to its prominency easily exposed from outside. For that, it is called beauty bone. So why it is called the beauty bone? As this bone is situated in the upper part of the thorax, and due to its prominency, it is easily exposed from the outside. For that reason, it is called the beauty bone. Now we will discuss about the flow chart of clavicle. Now clavicle has two ends and one body or shaft. So lateral end, medial end. Lateral end has also a name, that is acromial end, and it is sternal end. And we have body or shaft. And in case of lateral end, we have the attachment of to scapula, and here also the presence of coracoclavicular ligament. And in case of medial end, here is the attachment to the sternum, and here we have the sternoclavicular ligament. Now body has two parts, medial 2/3, lateral 1/3. Medial 2/3 has four surfaces: superior surface, inferior surface, anterior surface, posterior surface, and it is cylindrical in shape. Lateral 1/3 has two border and two surfaces: anterior and posterior border and superior and inferior surface. So it is all about the clavicle. So what we have discussed today: first of all, the lateral end, the attached with the acromion process of the scapula and forming the acromioclavicular joint, and it has the attachment of the acromioclavicular ligament. Then comes the medial end, which is attached with the sternum or manubrium and forming the sternoclavicular joint, and here is the attachment of capsular ligament. Then comes the body or shaft. Body or shaft has the attachment to the medial 2/3, and in case of that, the superior surface, inferior surface, anterior surface, and posterior surface. First, from the superior surface, there is the attachment of clavicular head of the sternocleidomastoid, which muscle is also known as Pandora box. Then the inferior surface, here is the attachment of the sternohyoid muscle. Then the anterior surface, here is the attachment of pectoralis major muscle. Then in the posterior surface, here is the attachment of, at this surface there is a groove present that is known as subclavian groove, which is present for the attachment of the subclavius muscle. Then we come to the attachment of lateral 1/3. That is the first anterior border. Here is the attachment of deltoid muscle. Then the posterior surface, here the conoid tubercle, which is attached, which has the attachment of the conoid part of the coracoclavicular ligament, as well as the attachment of trapezius muscle. Then the superior surface, there is no such importance. Then inferior surface, there is the trapezoid ridge, uh, where is the attachment of conoid part of the trapezius muscle. Then we have a question, that is the why clavicle is known as the beauty bone, as this bone is situated in the upper limb and upper part of the thorax, and due to its prominency it is easily exposed from the outside, and for that reason it is known as beauty bone. Then we discussed about the flow chart of the clavicle. In the lateral end, we have the attachment to the scapula, which is and also the coracoclavicular ligament. Then in the medial end, there is attachment to the sternum, where the sternocleidomastoid ligament also present. Then the body of shaft, it has in the medial to third there is four surfaces: superior, inferior, anterior, posterior, and lateral one third has two border and two surfaces. One is anterior and posterior border, superior and inferior surface. So this is all about today's topic, clavicle, and we have today completed the clavicle. So if you have any query or any doubt about the clavicle, you can ask in the comment section, and do like, share, subscribe to my channel for supporting me and my channel, and thank you so much for watching the interview.